Hello and welcome to this UCAT preparation advice video. So in this video we're going to be talking about the situational judgment section, specifically risk avoidance questions. So throughout the situational judgment section of the UCAT, you're going to need to be aware of risk. And that may be risk to patients, risk to other healthcare staff, risk to students, risk to yourself, and also risk to the profession's reputation. So how should you go about avoiding risk? And how can you make sure that you give safe and sensible answers throughout the UCAT situational judgment section? Well, let's find out. So in this video, we're going to go through some key points to remember when it comes to managing risk, and we're also going to go through a typical question on risk avoidance together. Let's start off with some key information. So firstly, risk to patients should always be your number one concern. And that could be as a result of your own actions, of someone else's actions, or of something else, even something as completely mundane as a slippery floor, for example. And risk to staff is also a very real concern as well. So consider if they may be overworked, or if actions taken by you or by someone else can cause injury or problems for them. So typically this looks something like staff not following infection protocols or not disposing of equipment correctly, for example. Risks to students could come in the form of a medical setting or completely outside it. And you have to remember that students can have a lot of complex issues in their personal life interfering with their university life. So you need to be ready to help wherever you can. Make sure that you're never putting yourself at any risk. So if a patient starts to act violently, for example, make sure that you call security and don't act rashly, don't try to sort the situation out by yourself. And lastly, never risk the profession's reputation. So that means upholding high standards of behaviour, not only as a doctor, but also as a medical student. Okay, so let's go through an example question together to put everything we've talked through into context. So I've got the question down here in front of me, and I'll also pop it up on the screen here for you to see. So, whilst walking down a busy corridor in a hospital, you notice that a nurse has spilled a bag of IV fluids, a harmless fluid consisting of salt and water, on the floor. You realise that the floor has become very slippery as a result. You're on your way to a tutorial and are running a little bit late. How appropriate is the following response? Speaking to a porter and asking them to deal with the situation. When approaching this question, we need to remember that your first priority here is avoiding risks to patients. So here you are going to have to deal with this situation, and actually dealing with seemingly minor issues like this is within the duties of a doctor. So here you're going to have to recognise that this is a situation that you need to deal with, but you also still need to place importance on your own learning. You're running late to a tutorial. So a good option would actually see you speaking quickly to a porter, making sure that a sign is put in place to warn people of the wet floor, and then carrying on to go to your tutorial. So in fact, that response is very appropriate. One of the most important things to remember in these questions is to always take actions to make sure that other people are safe, as long as that falls within the scope of your role. So for example, in the question that we just went through, it is perfectly reasonable for a medical student to deal with that sort of situation. But if you're faced with a different scenario, for example, where maybe you saw a patient seizing in a hospital corridor and you were a first-year medical student, you would not be in a place to be able to deal with that situation yourself. And you are definitely not ready to take the lead here. So in that sort of situation, the most appropriate action would be to immediately find some help, because it's definitely going to be nearby, and not to try to put any limited knowledge or learning that you might have into use, because that's actually dangerous for that patient. In this video, we've talked about the sorts of risks that are involved when it comes to patients, other healthcare professionals, other medical students, yourself, and also the profession as a whole. And we've also talked through an example question together. So hopefully you feel a lot more comfortable with recognizing risks and figuring out how to deal with them.